The Average Citizen podcast aims to respectfully explore a variety of topics in the hopes of broaching understanding between each other and our listeners. We don't claim to be experts, but we want to model how average citizens can discuss, debate, research, and explore sensitive subjects. This week's episode addressed the COVID-19 pandemic. We want to acknowledge that COVID has had a permanent impact on many of us, and emotional reactions have been understandable. Many have lost loved ones. At the same time, we discussed some of our concerns with the way the public response was managed and what to expect going forward. We hope you find our discussion respectful and thoughtful. Please enjoy.
Live. Welcome to episode 3 of the Average Citizen podcast. This is your co-host Tim Dowling alongside
co-host Tom Creighton. Welcome back. Welcome back, yeah. Tim. How are you?
I'm good, man. I'm really good. Life continues to be good for me. Busy as can be, which is really good. So admittedly, have not done quite as much homework here, but I feel like we've been so inundated with this topic over the last year that that's kind of the point, maybe, is that nobody really knows. Nobody's really an expert. And so you can know probably from the title of this episode, we're talking about the COVID-19 pandemic, worldwide pandemic. It was kind of, I mean, if we can, what a long year it's been now about a year. We're recording this on March 18th, 2021, which is about a full year since the shutdown occurred, at least in the US. And just to reflect and kind of flash back to a year ago, and I'll share, I guess, a personal anecdote is, I've been getting the flu shot the last 3 years. And the first year I got the flu shot, I was kind of sick for a night and then I was fine. The next 2 years I got the flu shot, I've been totally fine and I've not gotten the flu. It's worked. And I'm someone who used to get the flu every year. So I had been healthy. However, a couple people in my office a year ago, around this time, actually in February, got sick. One was my boss. She was sick for about 2 weeks and she's never sick. And she had dry cough, the symptoms that we were told early on. And then another coworker or colleague of mine also got sick. And he ended up passing away about a week after he contracted whatever sickness it was. Again, this was in February. So we had only heard about the coronavirus kind of through the airwaves from China. I remember seeing posts on Reddit and Twitters from Wuhan. They're panicking. I'm seeing in the comments, people are making doomsday predictions. And of course, it's internet comment threads, so you're kind of whatever. But lo and behold, there was some truth to the urgency. Anyhow, so my colleague passed away. There wasn't, he was tested for COVID and it was negative. Who knows what the test really, what kind of test we really had back then. But it was pretty sombering to know. And then it was about a couple weeks after that, everything was shut down. So to date, over 500,000 people have lost their lives to COVID-19. Millions more have been infected. And before we dissect or explore the ramifications of the pandemic and whatnot, we just want to honor those who have lost their lives of any age and of any nation by just a quick, 5-second moment of silence to think about them.
Thanks for that, Tim. I think that's important. I'll just echo, if you don't mind, or try to add a little bit to your sentiment that bit of a sneak preview here. In the next 55 minutes or so, some of what you and I are going to talk about is talking a little bit about maybe we overstepped in certain ways and how we handled things. Maybe there needs to be a more robust understanding about ways in which our response to fear and our response to risk needs to be rethought. And doing so is going to require us to talk about some what I'll call cold hard truths about some of the ways in which this virus has impacted people differently. And I'm glad you introed the way you did there, and I will just echo it and let our audience know that everything we're going to talk about, we still have all the utmost respect for people's individual circumstances. That you know someone who died or got really sick. That was scary. That's been hard. We really honored that and acknowledge that. At the same time, we're going to have some discussion here about things that have happened, and we mean no disrespect at all by talking about it the way we're going to talk about it.
Absolutely. And so just, to zoom out and talk philosophically, death is a part of the human experience. It's a part of life, as well as disease. And disease is as natural as human beings are. And viruses are older than human beings. It's just part of being alive on Earth is getting disease, getting sick, and passing away. I would say I'd like to also add that it's, even though it comes with a lot of pain and heartache, and stress around, no one likes to get sick, especially seriously ill. No one wants to lose a loved one. But again, kind of looking out philosophically about the bigger picture of the human race and its relationship to disease, viruses and disease have actually helped us evolve. And getting sick is actually, good for your immune system. So collectively, there's always a silver lining. There's always another flip side to the coin. And the way that we've learned information about this coronavirus and the inconsistent messaging around it, because I think that one of the scariest things, at least for me initially, is, as I'm watching again a year ago in March and April, as we're just beginning the shutdowns, is where I'm watching the case numbers, and I'm watching the fatality rates. And anyone can do basic arithmetic or averaging and figure out what the fatality rate is. And I realized it was, wow, that's really low. And I remember even thinking then, like, what, people aren't really dying of it too much.
Yeah.
What's really going on? But I had to keep reminding myself that it's also a novel virus. And even now we still are unsure about how it can mutate, what the variants are going to be. There's still some, questions about the long-term effects. But I think early on, the fact that it was novel just added to a lot of the, I don't really want to say hysteria, but just a lot of the confusion, I would say, around it. Because obviously a pandemic like this and a disease like this that is super contagious and rampant and is deadly to, a large portion of the population, requires massive action. It's not like we should just let people get it, and we shouldn't try this insane, in my opinion, herd immunity strategy wouldn't be good either, because it was so contagious that so many people could get it, that even though the percentage is low, whether that's hospitalization percentage or fatality percentage, which if it's fatal to them, they're probably going to be in the hospital. The big concern there was taking up hospital beds. And so I think that was kind of the logical response, right? Is to the people who were like, it's not deadly, why are we being hysterical about this? Well, it may not be deadly by percentage wise, but so many, X amount of people, or what's 3% of 330 million people in America, 3 million or whatever, and there were only a limited amount of ICU beds and beds. So when you overflow the hospital system with these infected patients, that screws up the whole hospital system and screws up people who still need to use it for various other diseases and injuries and things, right? So that was, I remember, really the key point kind of last spring, early summer, about why we want to keep the case numbers low, because we're looking at hospital beds and trying to keep our hospital system, fluid and open and available as much as possible. Do you remember messaging like that, or do you disagree?
Yes. So, okay. I think you did a nice job there of talking about what did we come into the early phases hearing and thinking we were starting to understand. So in a sense, you could say that, and this is kind of my thesis for this episode, is that a lot of our reaction, I even have some notes here, a lot of our reaction to this in March, April, May, I agree with you, it was somewhat understandable. We didn't actually know how, quote, bad it was yet. Like you said, we didn't know a lot about the virus. And unfortunately, it was going to require people getting it and some people dying to actually start to learn more about how it spreads, who's it going to impact worst, et cetera, et cetera. And then, yes, because of the what we now know in hindsight is that the coronavirus is this particular virus. It appears to be about 10 times as contagious as the flu, as like your typical flu, but it's actually less deadly to a healthy adult under the age of 65. The average healthy adult or child under the age of 65, it's actually less deadly than the flu, and the death numbers show that. But what's brutal about this disease is that it's actually more deadly to the elderly and sick populations. So that's a piece of this that we've learned now a year later. And as we moved into summer 2020, there were people that started to say, hey, we've had a few months of this now. We did the deed. We did our best to keep things flat so we didn't overwhelm hospitals too much. And now I remember reading an article in the fall, and actually, for all the notes I took, you were laughing at me before the episode. I actually didn't go find this article. There was a group of doctors who were actually saying, what we know now is that the true at-risk population for serious illness and disease is the elderly, 65 and older, over, or folks with very serious, they call them comorbidities.
Right.
Which maybe we'll get into that a little bit later. Some of the other things about just public health that I think we need to really have a hard conversation about. We'll table that one. So everything you said, I'm with you. Early on, for like, hey, a month or two, we need to keep things tight. We need to limit your exposure, especially if you live at home with elderly people, right? And then into the summer we go. But at a certain point, once people started realizing, hey, seems like for most people, this is going to be like getting a cold. And we know that we should just be protecting the most vulnerable. We should do what we can to make adjustments to our health policy guidance and the way that we message how truly alarming this is and be realistic about it. And that didn't happen. That's really my critique of how things happened, like going into the fall and winter. And I'll give you some information here that I think is really interesting. So I showed you this graphic, and I don't know if you have it, or maybe I can try to share my screen, but this blog that tracks data for COVID every week, they recently had some interesting data on masking, which is, of course, a very controversial thing. that
I mean, it's only controversial. Wearing a mask is only controversial to the very fringe, it seems, right wing conspiratorial types. I don't think any reasonable person really has an issue with wearing a mask indoors in an established business, right?
okay, good delineation. So I think you're right, and the data shows that masking compliance based on some behavioral polling, which behavioral polling is not perfect, right? But anonymous behavioral polling, like when are you wearing a mask? I think you're going to get. I'd like to think you're going to get pretty honest responses to a simple poll like that. So it's YouGov polling, apparently 80, somewhere in the 80 to 90% range on masking. And to your point, I'll speak for myself here. Like, if I'm going into a crowded grocery store, if I'm going somewhere where there's really tight spaces, lack of ventilation, like that's where there is some evidence to suggest that the mask is going to be a mitigating factor. It's not a panacea, which I do feel like a lot of people that on the very extreme, like I'm going to be compliant with the public health policy, kind of were like, this is how you stop it from spreading, and thought that, oh, well, if people are wearing masks, it won't spread. And if people aren't, it will, and kind of binaried it.
Yeah.
And I don't think that was appropriate either, because in the Atlantic article that I'd like to encourage everyone to read, it's called 5 Pandemic Mistakes We Keep Repeating. We'll link that article in the post for this episode. One of the things that she talked about, the author, is that people view these public health guidelines as like black or white. Like, okay, so I'm going to follow the guidance and I'm going to wear my mask, and that means like the risk is going to go away. And so then that mindset in a lot of people makes them think like, since it's all or nothing, right? That it's like, oh, if someone is taking a different behavior that I don't agree with, they're like, it's like terrible. Like this is going to be death and destruction because of this difference in approach. And so that is something that I do think led to, I know you said earlier, I don't think it was hysteria, but throughout the course of the year, certainly behavior I've personally observed in terms of the way people have talked about this, the communication and the level of fear to me seemed way unwarranted, given what could have been a very reasonable, balanced understanding of how to appropriately mitigate risk without like just going nuts about it.
I understand what you're saying. I in my opinion and in my interactions, again, and this is my appeal to the average citizen and my appeal to reason. I think most people are reasonable, and I think most people are like you and me and can kind of not get to that hysterical level. But even I have had certain interactions where I would kind of think that was an over top reaction as far as erring on the side of caution.
Do you want to give an example of
Yeah,
that? Because I have some too.
Really quick. Another disclaimer, kind of meta for people who are watching on YouTube, our YouTube video, or actually see the video. Sometimes you'll see me look off screen, or Tom maybe look down. We have notes, and I have another monitor here. So just a quick disclaimer, I'm not distracted. Tom, you should know that too. I'm just trying to like find the right data and whatnot. But yeah, an example, I mean, I was in a small store, really small, like even prior to COVID or anything, this was not a store that had seating. It was a chocolate shop, I'll just say that, or a candy shop or whatever. And you come in and it's like one counter, and there's signs on the door saying, hey, like wear a mask, social distance. I didn't, everyone's had those signs. I didn't really look at an occupancy sign or anything. I went in with my mask on. The clerk or whatever has her mask on as well. We're interacting, it's fine. And then someone, another customer, attempts to walk into the store behind me. He also has a mask on, and opens the door. And immediately, I mean, and he's probably within 6 feet. I don't know, in my opinion, like whatever, I think we're fine. But she kind of snapped at this guy as soon as he walked in the door saying, hey, only one at a time. Like, gosh, like I don't want to get people sick in here. Da, da, da. And the customer was like kind of taken aback and was like, oh, like, I'm sorry. And so he just left. I don't know if he came back, but like she was upset, and her emotion, you could just tell, just ramped up. The fact that this other customer who was wearing a mask, being reasonable, may have missed the occupancy sign. I don't know. It just seemed like kind of crazy.
Yeah.
But however, the other points that I wanted to bring up were, I guess it's just so personal. Like, yes, by and large, it is a more serious and fatal disease to those who are over 65 and may have an illness or a health condition. However, we do know that perfectly healthy young people have also had fatal contractions with the disease. And those are rare, but those are powerful. And it only takes, the human mind is conditioned to really focus on the negative and to focus on those threats and those risks. So all it really takes is one person of a friend that you knew personally who was perfectly healthy to get sick and die, to therefore justify every single freaking safety thing that you can go by.
Do you mind if I?
And just to further cement the point that every death is like precious, and every life is precious, and every death is impactful. There's a Vox article that was like, I said over 500,000 deaths earlier in the episode. It's actually now it's over 530,000. So you might be listening to that and you're like, wow, what's the difference? 30,000 lives is the difference. And Vox did this article about like, that's such a big number. And I think humans, whether it's trying to imagine how much $1 billion is really worth, trying to imagine 530,000 lives, it's hard for us to really comprehend like what that really means in reality. So Vox did this article where they like calculated the average lifespan of males and females in America or whatever. And then they calculated the average age of those who passed away and did the difference. And it's like, how many years of life did we actually lose because they took lives too soon? And it's so, it's natural to think like disease, that's what they're supposed to do. They're supposed to kill off the elderly and the sick. They do it in animals. They've been doing it to humans forever. That's how we get stronger and we evolve. But when it's your parent, when it's your grandparent, it means a lot. And so like 3.9 million years is what this Vox article came up with to calculate the amount of life lost in a way that's just a little bit like gives, I think, a little bit more due to how impactful it really is. So I just wanted to balance that. That being said, we do have to weigh the risks. And to your point about thinking in black and white terms, if I wear the mask, I won't get it. If I don't wear the mask, I will get it. And it almost this life or death. I mean, it's only natural for the human mind to think in those ways when they're experiencing a fight or flight or a fear kind of reaction. But yeah, there wasn't good messaging from the start. I think we had a pretty shitty president at the time who was never good at communicating well about anything. So you can only wonder what kind of messaging could have been better. But he did say things, like it's like the flu. And so he was, in some ways, I think the messaging, at least from the previous administration, was like, he tried to downplay it, saying that it would be gone in 2 weeks or whatever.
And that was stupid.
We wouldn't cross, this threshold of deaths are contagious. And he just downplayed the shit out of it. He should have said, hey, this is a real serious thing. A lot of people are going to die. We're going to do our best. Obviously, he's not capable, in my opinion, of any kind of successful messaging, other than its brand, I suppose. But I was also seeing kind of like people's reactions, like when people are flying or just the mask thing in general. It is all about reducing the risk. It's a gray area. You can never get 100% either way. And that's another concept I think the human mind has trouble really grasping and understanding, maybe, especially in a heightened sense of like fight or flight. But yeah, back to you.
Okay, a few things. I was trying to really actively listen, so I'm going to try to backtrack. So I do want to go back quickly to the lady in the store, right? She snaps at this guy.
Yeah.
I think you did a nice walkthrough, and if I understand the point of what you were saying there, you weren't condoning it, but you were explaining that all it takes is one close connection that has something terrible that ramps up the fear and might cause people to start reacting that way. Am I understanding that's what you were getting at there?
Yeah, sure. I mean, who knows what's going on in her life, but maybe she just had was stressed from work, and there's a variety of things that get people operating up there.
So I've witnessed a few odd situations over the summer. So look, I'll be transparent. I have looked at the science. I have looked at how we know everything we know about this disease and how it spreads. And the risk of outdoor transmission is effectively zero. Effectively zero. You could envision a situation where you've got like 1,000 people in a super tightly packed space, and maybe one of them has COVID and they're like really getting in people's faces, and like you could envision a situation like that where it might be possible. But like the average outdoor experience, where to be honest, when you're outside, you're 6 feet away from people, like almost exclusively anyway.
Yeah, I mean, well, golf was something that I think was, we had like a month in Washington where I think, was it even a month? It might've been 2 weeks of like a hard shutdown.
But people were like, this is stupid. Like, what are we doing here? You know? So
yeah, there was, and like, anyhow, like golf also, real quick, just on that point, was always open because you're outside. But then there was, even during the summer, this contrast between Trump holding his rallies, campaign rallies and stuff inside, with thousands of people inside. And then you had the Black Lives Matters protests outside, but also thousands of people. And there was like, well, I guess it doesn't exist for them, but it exists for us. And like this inability to wrap their mind around how there's a difference in the way that, when you're inside, it's condensed and we're sharing air more often than outside. So anyhow, just another failure of public messaging or people to really understand.
Well, and so, okay. So real quick, I just want to say, so the story I was going to tell is that I was out on a walk with my kids and my wife in the middle of the summer on a beautiful day. And we were just walking down the street, and this old lady yells at us because we don't have masks on. Mm. And it's like, I almost said something to her, but she just, she of course was huffing past and wanted to just get her say in, which that is just a cultural thing, frankly. Like, there are people that just want to get their piece in. But to me, that is an example of someone abusing a situation. They have ammo against us because they can use this situation to try to scold or shame and make themselves feel better. And if it really was coming from a place of fear, my argument would be, if you are that afraid, like, you need to level set yourself and go meditate or be truly away from everyone. Like, don't yell at us. Anyway, that was one example. Another example recently, there was a girl on a run, like huffing, really running, no mask on, which is the advised guidance, by the way. If you're physically exerting yourself, they actually advise not wearing a mask because of hyperventilation and other concerns. And this, she's running down the middle of the street, totally away from everyone, in the outdoor air where it can't recirculate anyway, right? It's no risk, literally no risk. And this woman just yips at her as she's running by about not having a
I
mask.
don't think that there's been clear messaging about, because I'm starting to play adult flag football again and like outdoor sports, and we have to wear a mask on the field.
It's stupid. That's
Which
so
it
stupid.
hasn't bothered me. I mean, I haven't really been huffing and puffing either, but there hasn't been clear messaging about that. I don't think until recently was I really like astute to or aware of how minimal it really is when you're outside. That still hasn't, I haven't heard that from Fauci or anyone else. I think some of the messaging really was just screwed up by Trump because he was downplaying it so much, and then Fauci had to almost like counter that by like ramping it up, like, no, this is really serious, you know. So then it just created these conflicting messages.
Yeah, I think I do think Trump owes Trump certainly. I don't want to let Trump off the hook with what I'm about to say. Trump's mixed messaging and just like his unreliability as a messenger generally, right, didn't make things any better. There's no question. But I do want to say about Trump, though, is the voice. I actually think he was kind of, and maybe for biased reasons, but he was trying to be the voice of like, let's not panic. And
Right.
the sad thing is
He's
that
not
maybe
presidential though.
What's that?
A real president, he's not presidential. A real president, like even you could see Obama in that same situation, who was like, you know, so eloquent, or just any real politician, and that probably has a negative connotation, would be able. It's so important though to be able to message that to the population and to be that voice of reason.
Yes.
He was unable to do that.
Yes. And
so
so
he was trying to.
From that standpoint, I don't let Trump, I do hold Trump accountable to just not being the leader we needed in the moment. That being said, kind of combining a few different thoughts here, but this whole idea of like, well, Trump is not going to listen to reason and Trump is going to not follow guidance. I did get the sense, and this is maybe more of a dynamic on social media, which we talked about in episode 1, this like tribalism.
Which we are going to continue to bring up in every episode because it just runs through the veins of discourse now.
Yes, right. So maybe you know what I'm about to say, but like there was very clearly, and I've read articles by commentators that have noted this, like the willingness and like happiness and jubilation over praising people that we're going to follow the guidance. We're going to be, quote, the good people that follow guidance. And like, we're going to do what the CDC tells us to do, even if it makes no fucking sense. And that's where I think you get a lot of this, like, well, you know, the CDC tells me to wear a mask when blah, 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 blah. And so we're going to do that. And it's like, oh, you don't think we should, you know, you're a Trump, you're just a Trump guy. Then you're just an anti, you know, conspiratory, whatever. And it's like, no, you know, I mean, speaking for me personally, and no one has called me this in person, but just knowing what the messaging is, it would be very challenging for, like, I think this nuanced perspective to get into the conversation because people are so willing to be like, well, anyone that's not going to listen to the guidance is just following the Trump train.
Yeah, and that's an overarching theme of any nuanced discussion now is that you have to almost give a disclaimer when you're about to, you know, disagree with something or okay, like I'm not for this. I don't agree with Trump. I'm not a QAnon guy and I'm not a Trumper. However,
the CDC is not being clear. However, I think I can wear a mask. I think I can be maskless outside because there's no risk. And like, that isn't.
Yeah, it seemed like there were some, like, I just remember, so a couple of examples of just I can't think of the word right now, kind of like not showboating, but like it's for show almost, like in the NFL season, like the coaches have to wear their masks on the sideline.
That was the dumbest, so stupid.
And everyone's like, and it's just, And then in the same vein, there's still to this day a lot of clips of people at government press conferences, different government officials who aren't wearing a mask off camera. They put the mask on camera to walk to the podium, then they take the mask off to speak. And it's just like, you can see whether, like, it is just to like reinforce the message that we need to do this. And you can make the argument, I might try to make the argument that the reason for that counter, like, over the top is because it was so downplayed from the beginning. And so maybe that was the strategy to counter the downplaying from the previous administration, was like, well, shit, now people aren't going to take it seriously at all. So maybe we need to like demonstrate or at least show. I don't know.
Look, respectfully, I would disagree with that. The article, again, I'm going to reference it, the pandemic mistake, the patronizing paternalism is one of the mistakes. This assumption that the public is stupid, it's got to go. It's got to go, because the public is not that stupid. And when the public sees what you're talking about, they're like, well, shit, clearly it's not that a big of a deal.
Right. We were all thinking that. We see Pete Carroll or whoever, and we're just like, this is pointless. It is phony.
Yeah.
Yeah, that's
so, like, look, the NFL could have set an example. The NFL could have set an example, and they could have said, hey, listen.
Was the data clear in the fall about the outdoor stuff?
Yes, absolutely. It was quiet, right? And this is kind of, I hate it. I hate even talking about it this way because it sounds so conspiratorial. But there were quietly things coming out about being outside. It's circulated in the air, meaning that it requires. Have you heard the 15-minute rule? Have you heard that?
No.
So, it's not like, you know, for the folks that say, you know, we're the party of science, the Democrats sure made it really hard to actually have a discussion about the science of this virus. The rule that people are talking about now, and there's even examples of restaurants trying to hack the 15-minute rule, because what we understand, it's not like a single molecule droplet of COVID is going to latch in and you're going to get COVID. What we know is actually a requirement to get it is consistent exposure over a period of minutes from the virus. So
that makes sense. I mean, anecdotally, I've heard of couples, people that I know who are coupled. One of them got it, tested positive for COVID. The other one did not. These are romantic couples who are sucking face and swap and spit and spending all this time together. How does one get it and one does not? We're going to take a quick break and listen to a word from another Chatter Network show. Be sure to check out thechatternetwork.com and take a listen.
Do you like movies? Of course you do. Do you love movies? Well, so do we. How's it? I'm Alex McCauley, host of Excuse the Intermission, a discussion show surrounding movies. Join me and my co-hosts Max Fosberg and Grant Colombini each week as we conversate about films from the past, the present, and the future through fun and engaging podcast formats like movie drafts, Hall of Fame lists, tournament brackets, and film reviews. So whether it's the newest blockbuster or a resurgent black and white cult favorite, you can count on us to keep you in the know on all things movie related. Excuse the Intermission is a part of the Chatter Network.
And one does not. Because within that contagion window, they didn't spend that 15 minutes or whatever it was.
Exactly. And if you're moving throughout a space, like the proximity of the particles that you're exposed to, and I'm no scientist, so I'm just kind of speaking it in layman's terms here. Like it does require serious amounts of recirculated air with high volume, outward exposure. And in addition, one of the things that we know now is the models suggest that there have actually been over 100 million people that have had it in the United States.
The
So
whole asymptomatic
exactly.
population.
So there's been 30-ish million confirmed cases that, which is going to be most likely, those will be the symptomatic ones, because the most likely reason you'd get tested and confirmed is because you have symptoms.
Right.
Then there's going to be additional cases that were symptomatic, but the people were like, oh, I just don't feel great. And then there's another suite of folks. The estimate is about half of cases are asymptomatic. So 50 million, let's say. So that's the other thing too, is the asymptomatic cases, apparently, we don't know how much those spread versus the symptomatic cases. So there is still a lot of uncertainty, but just to close out my thought about what the NFL could have done is the NFL could have said, we want to make it very clear that we've asked our teams to follow protocols to minimize exposure, retain a bubble within your team. Don't expect your players to follow good social distancing protocols. Don't go to clubs, which some NFL players did. And then what do you know? A ton of people got COVID from the club, which is like, to your point earlier about these people that act like, oh, fuck this. Like, it's my rights. I can do whatever I want. It's like, no, but let's be reasonable about what we're going to limit your ability to do. Because overstepping our bounds from a public policy standpoint and limiting people's rights is a little bit like, well, don't tell me I can't do stuff for stupid reasons, but tell people, sorry, clubs, bars, really small indoor restaurants that can't space people out and ventilate, gyms, all these places where the obvious high risk points, sorry, you're going to have to be shut down. And now I would even say, as you and I are kind of fellow social democrat ideologues here, we should have had a public relief response that was just really fine-tuned to, we stack rank industries by risk and we draw a line somewhere that makes sense. And we fund those people that we're going to shut off and let others that are low risk operations keep running. And there was no way that was going to happen, right? There's kind of a public policy failure across the board there. And then the NFL should have said, we're asking our teams and players to follow these protocols, but you're not going to see them wearing masks on game day because they're outdoors and they're amongst each other.
And there's, to kind of, exactly. And to kind of touch on the fringe, these are my don't tread on me people who are anti-mask and all of this. There's still a personal responsibility, and I'm glad that you mentioned that. The shutdowns in those specific cases of high risk place is warranted. Movie theaters is another one that would be a hotbed, right?
Yep.
So it's about finding the nuance and the balance between those things. However, you do have the right, I would think, those NFL players, or if there was a waiver or something for flag football where you personally want to take on the risk, then you should have the right to do that.
Yeah.
And maybe that would be another type of public policy thing that they could, or guideline that they could introduce to businesses. However, there might be just too many people who are like, fuck it, I'm just going in. Anyhow, it's kind of a trail of thought. I want to, if you're done, kind of transition away from the failure of messaging and the inconsistency on the data. I think we've nailed that enough. And maybe we'll just close real quick with an example of this video by CBS News. And the title says, experts, who are they? Experts say COVID-19 will never end. So let me just share. We're just going to get this. Oh, host disabled participant screen sharing. So maybe we won't do this.
Okay. Well, you know what? Let's just talk about
that headline.
Yeah.
Let's talk about that headline. Will COVID-19 ever end?
Well, do you want to go first, or you want me to go first in responding to that headline?
I'll go first in that the disease itself may never end, but there will be some type of return to normalcy. We're already, vaccinations are rolling out, and we'll get to the vaccines as well, maybe right now. I mean, I won't yet, but vaccines are rolling out, things are opening up again. I even saw like we can karaoke again, like there's certain live music if it's outdoors in space. Like we're gonna get back to something, like society moved on from the 1918 Spanish flu, SARS, all those other ones. Like we're gonna get through this, but we will forever keep it in our minds. Like it has left an imprint on our psychology, I think, more than anything. I think it's made a lot of people really understand there's kind of a sacredness to public spaces and shared public spaces and shared experience, not having live music or even just going to the grocery store. It's odd to even look back at certain videos pre-COVID and see how close people were standing next to each other. And what I think there's going to be probably a greater sense of intimacy when public spaces begin to open up again. Even just being within 6 feet, people will probably still keep their distance and not be quite as close, but to even be inside or to be in the grocery store without a mask, I would think that is in a possible future, maybe by the end of the year next year.
Tim, I think we're going to be there in the summer, to be honest.
I would think that the data is probably going to be there, but psychologically people will not. I think there will be a lot of people who are still going to voluntarily follow those guidelines out of their own, risk factor.
Got it.
Yeah. Will it ever end? Yeah, in some sense, and no, in another sense. I think, there will be, there'll probably be another type of pandemic and whatnot, but that kind of sensationalized headline is only going to get the fringe thinkers really riled up about governments are taking our rights and shooting us up with microchips and stuff like that. This idea that they're going to COVID-19 is going to shut down our freedom forever is false. I think that's all I really have to say. What do you think about that type of headline, or do you think, or the question itself, will it ever end?
To me, this is an example of modern journalism where the headline is like literally accurate, but also pointless and not useful and sensationalized. So, because you've been speaking to, there's this psychological response. So a person who is going to approach the topic with like, wow, COVID's been really bad, right? The term is COVID. COVID means pandemic, disease, death, social distancing, masks, some fear. Like COVID is all of this. And so the headline, COVID-19 is never going away. We should read the article. Let's link it in our video when we post. But my hunch is that if you actually read the article, it's going to say the disease itself is not going to go away. We're not going to go to 0 cases of COVID. It's not going to be a quote dead disease. People don't know this, but you know what else isn't dead? Polio, MMR, whooping cough, all these other diseases that are actually very, very, very serious. Now, they're contained because of vaccinations. We have science, and we vaccinate infants for the very severe diseases. Polio was referenced in the pandemic failure article. People were celebrating in the streets when vaccinations were rolled out. And that was another failure. And that's why I don't like this headline. We need to be positive right now. Topic we didn't get to touch on, and I know you wanted to get to vaccines. So let's get to vaccines, and let's talk about the positives of the vaccines and another negative, which is how we've talked about them. Positives are they were developed in record time. I think 8 months.
It's a huge feat of humanity that was developed as fast and as court like that is it doesn't it takes vaccine years to be able to be dispersed to the public and tested and over. It's usually typical vaccine development is like 3 to 5 years or something. Like it's a long time. 8 months. It's also a new type of vaccine that's never been done with the mRNA.
Yep.
DNA type thing, which neither of us are scientists, but
new technology. It's there's so many things you could say positively about it. Sorry to say for the left-leaning listeners, it's kind of a success of capitalism in a way too. We have all of this incentive to drive these really high-tech developments.
Well, I would say that to tie in, we're probably going to continue to weave in our episodes, everything that
To go back to the last episode we did.
Go back to the last episode. So I think capitalism helped in the development of the vaccine, but it is hindered its distribution, just because of like there's so many different ones. It's just that typically you've got this competitive edge to want to develop it the fastest and safest as possible so they can capture, the revenue and be the first one and get it out there. And that drove a lot of the innovation and that competition. But now it requires collaboration to disperse it equitably and quickly. And we're getting there.
I actually would say it's gone pretty well. Like, and to your point, it's been a success of the public-private partnership that we advocated for is really the right model. I would say it actually screams success across the board. It screams the reasons why capitalism is good, and then the reasons why a public force as well that can partner with these innovators to
the right public force, right? Because we finally have maybe a social democrat in office who people actually want to govern.
Yes, it is concerning. It is disappointing that it seems to be coming out that Trump and team didn't really have a plan to like guide distribution.
Not even just the vaccines, but any other of the personal protective equipment and stuff like that.
Yeah. So anyway, I'd say vaccines, huge success. They work. That's the other thing. They actually.
I was under the impression, though, this was another lack of maybe my understanding or just public information. Is they work in the sense that you will not die or get extreme symptoms from COVID from the vaccine. I always assumed that the vaccine or any vaccine, what made it a vaccine was that it prevented you from catching it and being contagious. But they are seeing that this new type of vaccine, you can still get it and you can still pass it along.
I don't believe that second part is true. I don't believe that. So, okay, this actually gets to the point I wanted to make. And we should confirm this. One of our average citizen mantras, right, is like confirm with data, et cetera, confirm with research. Read the article on the vaccine development. My understanding is there's been messaging like, oh, it may not do these things, oh, we're not sure yet. And a lot of that is because scientists are very biased towards the pure scientific method, which is the null hypothesis is what we go with until we've proven statistic significance of what we think we want to prove, which would be, hey, we've proven that it's statistically significant in actually not letting you pass it to other people, right? You're not contagious anymore. And so it's a
CDC website, cdc.gov. What we know, studies show that COVID-19 vaccines are effective at keeping you from getting COVID-19. Although they're effective at keeping you from getting sick, scientists are still learning how well vaccines prevent you from spreading the virus that causes COVID-19 to others, even if you do not have any symptoms. early data show the vaccines do help keep people with no symptoms from spreading COVID-19, but we are learning more as people get vaccinated. So we still
they're hedging their bets there. I would call that they're hedging their bets. And what the Atlantic article said is that that's not smart. There's enough vaccine hesitation and skepticism built into the fiber of the culture as it is. And there's so much fear that people are dying for some freaking good news. It's like, tell them the freaking vaccines work. Get people to want to go get them. Like, hey, if everybody goes and gets vaccinated, we're going to be able to go back to normal. Like, pump some good news into the ecosystem. And that's another example to me of where the hedging of bets is like, hey, we don't want to tell people it's okay to take their mask off outside because then they might like go to a rave. And it's like, let's not assume people are morons here. Like, tell them actual reasonable guidance. It's the guy in the podium who doesn't have his mask on, puts it on to walk out, takes it back off, and we're like, you're full of shit. It's the same problem. It's like, the vaccines work. Tell us they work. Give us some good news. And that's where I'm at with it.
Yeah, I understandable. I mean, I think in the same way that the virus was novel early on, that we were like, oh, we're not quite sure how COVID will affect us. It's a novel virus. The variants could change. Even now, the variants could change. Are the vaccines going to work against the variants? Data is showing that yes, they are, luckily. But I think in the same vein, the public skepticism around vaccines is like, oh, this is a brand new vaccine, which has been created way faster, right, than any of these other vaccines, in a way as well that has never been done before, messing with my RNA, DNA, like what is the long-term side effects of this? So I don't know. I don't think it's, I'm a PR major. We're both comm majors. So we like thinking about messaging, and they might seem like subtle differences, but to really lead, and I think they've done a good job of saying it's safe. It's a safe vaccine. Get the vaccine. They're doing that.
Even Trump did.
Right.
Even Trump, God bless him. Even
he didn't
did
necessarily promote that as that much, but he did get it. He's kind of, I guess he is kind of endorsing it a bit, but I don't know. It's typically good PR strategy to be transparent and be like, hey, this is what we know. This is what we don't know. But to really hammer home that it's safe, still there's enough, I think, public skepticism around it that, I mean, you and I, we're not on any priority list. We haven't been vaccinated, right? Like,
Nope.
My parents have just gotten vaccinated. I don't have any grandparents. So that's not been a factor for me through this whole thing. But I'm not in any really rush to get vaccinated either.
Me neither.
We're not in an at-risk population, especially if I could still get it anyways or something. Like it doesn't seem to be. So I'm waiting for my insurance to let me know when I can get it. But I know, like, my older sister she's a healthcare provider, so has gotten vaccinated and is urging everyone who can to get vaccinated as well. And people just react differently depending on their circumstances about the urgency around it all. We touched on that. We're probably at about an hour here, actually. I'm just looking at the timing. We probably talked before we recorded for about 10 or 15 minutes.
We can, I mean, if there's another topic to hit on, we can run a little long if you want to. And
if
you want to.
Yeah, the only real thing that I kind of just wanted to wrap this all up with is just like thinking big picture again about, I wanted to talk about weighing risks and who do we prioritize in society. Because if you're looking back at any tribal population, early human ancestors, early civilizations, what you prioritize the youth, right?
And this is the like harsh truth that we were kind of we did the disclaimer at the beginning.
Yeah. Disease kills off the weak. And that is obviously I'm not calling anyone weak, but when you're older, and that's from a purely scientific, anthropological, biological, scientific perspective, that is what disease, that's the purpose disease serves in living organisms, is to
Can I add to that? Do you mind if I add to that real quick? In this case, COVID, we'll link this article in the publication too of this podcast. 88%, this is from 2 weeks ago, 88% of global COVID deaths are associated with countries where the obesity rate is greater than 50%. And the US is one of them. And you're going to talk about risk. I'm sorry to steal your thunder. I want you to say what you wanted to say, but just to add to your thing about, look, this is how disease works. It goes after the lowest hanging fruit. And this is the harsh reality, which is why we put the disclaimer at the beginning of the episode. So 88% of global deaths, obesity rate greater than 50% countries. Tim, I want you to guess, what are the top two preventable causes of death in the United States?
Preventable
causes of death in the United States.
Is heart disease count?
Number one.
And I don't know, I would just say like obesity, but we
cancer
on that.
Cancer. Cancer, not all cancers. Some cancers are like hereditary, but a lot of cancers we now know are health outcomes related to poor behaviors.
Cancer, of course, I should have known that. Wow, how insensitive of me.
Over 1 million deaths annually from heart disease and cancer.
Obviously, there are exceptions, right? I mentioned it earlier in the episode, and that would be the case for any disease. There are exceptions to the, going off fatalities for older immune compromised people. Obviously, there have been exceptions where younger people or healthy people, for whatever reason, whether it was something to do with how they contracted a really vital or fatal concentrated dose, or maybe genetically there was something else going on with the immune system. There are exceptions, but by and large, diseases go after the older populations or the weaker population, or however you want to term it scientifically. So healthy societies who want to continue to improve will plant seeds of trees under which shade they will never see, right? That's a common saying, that we want to prioritize the youth and protect the youth. And so I think a lot of the young people who are missing out on this, not just the educational aspect of schools being shut down. I mean, we can barely sit through some freaking webinars all day at our home office. Imagine trying to even pay attention for class when they don't even pay attention in real life, right? In person. But not only are they having a reduced educational experience, but also they're missing out on all the social type of memories. And so I think we're both, and you have children, so I know you probably have some anecdotal experience with this, but we need to think about the kids.
And we didn't. I'm going to be honest. We didn't think about the kids here. And we've said it multiple times. A few months into this, we had clear data that kids were not going to be a vector of transmission. So you could put young, healthy teachers and young kids into open air, schools, ventilate, maybe do half capacity and do half every other day or something, and kids get an extra couple days a week off of school. There were things that could have been done. There's private schools. Ironically, private schools have been open. There's a private school here in the neighborhood I live in that's been open since October. All of the elementary school age kids, 0 cases, 0 problems. They're wearing their masks and they're doing their protocols to be reasonable. But the kids are in school. They're seeing each other every day. And they're not doing stupid stuff like everyone's going to be in this green bubble. Did you see that one picture of that crazy school that put every kid in like a fucking
No.
thing?
No, I didn't see.
Let's link that too
We got a lot of links because we don't have a clip to share in the episode. We'll share a lot of articles.
Yeah. But yeah, kids, we completely abandoned any regard for kids' mental health over the past year.
Yeah, I think we've really have focused a lot on the disease and the health aspect. I guess the other bigger picture ramification I wanted to get to. I mean, obviously there's this whole impact on the economy and the way we conduct business, and then there's the mental health aspect that I also wanted to touch on, which you just, talked about. The psychological aspect, I guess, is a better segue right now, as far as what, anxiety and depression is at all-time highs, like a ridiculous, like 60-80% of people. Again, I should have that number down.
I have data for this.
Great.
A national study, and this was only in April. So this was only after like 1 month.
Jeez.
32 billion US medical record and insurance claims found that in April 2020, generalized anxiety order in the 13 to 18 age group increased 93%. And that's year over year. So between April 19 and April 2020. And then major depressive disorder claims increased 84%.
Yeah. I mean, I think there was probably a lot to contribute to that. It's probably compounding. I don't think it probably wasn't just COVID. It was probably also the political and social turmoil that was occurring as well.
Sure.
But yeah, overall, when people are, all those things going on, it's not good for our mental health. I think that's only exacerbated but with the youth. And then it's had this weird effect that I think segues nice to how we're doing business. But like, we were already, in my opinion, I think, over dependent on social media and technology. And this pandemic just kind of created the perfect circumstances to just dive into your phone or dive into technology even more so.
Yep.
I think there's obviously many benefits to it. It's a double-edged sword. Like, here we are on Zoom, for instance. Like, this is great. We can do this. We work from home. Most people are really enjoying that transition. But it comes at some cost as well. Like, am I going to be on my phone for 12 hours a day? Am I really supposed to look at a screen for 12 hours? I mean, I go crazy in this box that I call my apartment or whatever. It's just like, we have to get back to some kind of, there is an appetite, there is an urging to get back to those shared public spaces. But I think hopefully we can return to normalcy, wiser and better connected and more appreciative of those shared spaces and of that interaction and what that really means for us as humans to connect in the real world.
I think that's the end. I think you just ended it.
Cool. End it. Peace, y'all. Take care. Mask up, but be reasonable.
Be
Get
reasonable.
outside.
Go for a hike outside without a mask. Please, for the love of humanity, do it. And then get vaccinated, and let's go have a 4th of July cookout.
We love you.